Large blood clots during your period are usually not a standalone issue. They signal that the uterine lining is shedding quickly and the blood is pooling faster than the body can break it down with natural anticoagulants. Let's have a look at the most important underlying causes. Number one is estrogen dominance or unopposed estrogen. Because when estrogen levels are high relative to progesterone, it overstimulates the uterine lining and it causes it to thicken excessively. When it sheds, the volume is too much, too fast, leading to clotting. Then have a look at, are your cycles shorter? Is your PMS intense? Is your luteal phase weak? If you have PCOS and often anovulation, that leads usually to no progesterone. And if there's no progesterone or low progesterone, then estrogen is too high in relation and you get all these problems. Number two on the list are fibroids, adenomyosis or polyps as an issue. And they're structural and increase the surface area of the endometrium or interfere with uterine contractibility. And that leads to heavier flow and larger clots. And by the way, estrogen is here very often a main driver. So if you have pelvic pain, pressure and bleeding between your periods, then have a look at those. Number three on the list is inflammation in your uterus. So chronic uterine inflammation from, for example, endometriosis or past infections disrupts normal shedding and then the clot breakdown. So are there any digestive symptoms, for example, painful periods, or do you have immune conditions? Then this might be the cause. Number four is poor progesterone levels. And we talked about this already a bit earlier because progesterone stabilizes the uterine lining at low levels, then can lead to chaotic shedding, clot spotting, early periods. And it's usually because estrogen is then too high in relation. So if your luteal phase is shorter than 11 days, PMS is terrible, and your temperatures are fairly low post-ovulation, well, have a look at that. Then we have sluggish circulation or uterine congestion. When you have poor blood flow in the pelvis from stagnation, lymphatic issues, or sitting too much, that can impair the uterus' ability to expel blood efficiently, leading to pooling and clots. Now, if you have the MTHFR mutation gene, then you have folate pathway issues, and this impairs your ability to produce enzymes that help break down clots, especially if B12 or folate are totally deficient. So if you have a history of clotting, miscarriages, or even mood issues, then maybe folic acid is being used instead of methylfolate, and you might have that issue. An iron overload or an imbalance can also lead to clotting. While anemia is fairly common, excess unbound iron can promote clotting and inflammation in tissue. So if you are supplementing iron without even knowing if you're iron deficient, that might be the issue. Or another reason that's often missed on imaging is endometriosis, and it can create heavy bleeding, inflammation and clotting by thickening the uterine lining and impairing normal detox pathways. And endometriosis is often as well estrogen driven. So if you have really excruciating pain during ovulation or sex, a week or even more before your period, that's not normal. So get checked out properly. And what it usually is not, those blood clotting, is a clotting disorder. Though these exist, but they are very rare. Most people with clotting disorders bruise easily and have other signs like nosebleeds, prolonged bleeding from cuts, or a family history. So at the end of the day, clots are usually downstream effects. The root, almost always, hormonal imbalances, inflammation, and poor uterine blood flow. If clots are consistent, don't panic, but you do need to listen to your body. And if you have issues with blood clotting, then head over to my profile, because there I've got in the Fertility Circle a program that can help you to get rid of these clots as well. We're looking after your ovulation, your progesterone levels, detoxing estrogen levels, reducing inflammation. At the end of the day, we're making sure that your fertility is blooming and thriving. So at the end of the day, if you want to, you can get pregnant, stay pregnant, and deliver a healthy baby.